Welcome to today's video about early signs of high blood sugar. Did you know that a staggering 1 in 3 people have high blood sugar and don't even realize it? What if I told you that your constant thirst or that unexplained fatigue isn't just one of those things? These everyday moments could be silent alarms your body is sounding, but how do you decode them? In today's video, we'll journey through the mysterious signs your body sends when sugar levels rise. Can you guess what they are? Stay with us as we unravel the secrets of high blood sugar that might just save a life, maybe even yours. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Let's dive into the early signs of high blood sugar, starting with the first one, frequent urination. When your blood sugar levels rise, your kidneys spring into action. Think of them as your body's natural filter system. Their job is to remove waste and extra fluids, which includes excess sugar. Now, if there's too much sugar in your bloodstream, your kidneys get overwhelmed. They work overtime trying to filter and absorb the excess sugar. But sometimes they can't keep up. When this happens, the surplus sugar is excreted into your urine, dragging along fluids from your tissues. This is why you might find yourself running to the bathroom more often than usual. A study in the Frontiers in Public Health, 2022, found that this frequent urination can be an early sign of elevated blood sugar levels. So, if you're noticing those extra trips to the loo, it might be worth checking in with your doc. It's always better to catch things early, right? Next, number 2, blurred vision. When your blood sugar rises, your body goes into overdrive to get rid of the excess glucose. One of the ways it tries to do this is by drawing fluid from your tissues, including your eyes. This can cause the lens of your eyes to swell and change shape, leading to blurred vision. It's like trying to see through a foggy window. Research from the World Journal of Diabetes in 2015 demonstrated that fluid imbalance in the eye due to hyperglycemia is a primary reason behind this visual impairment. And get this, once you start managing your sugar levels, the blurriness begins to fade and vision can return to normal. So, if you ever notice a sudden change in your vision, it might be more than just needing new glasses. It could be your body signaling high blood sugar. Next, number 3, fatigue. Fatigue as an early sign of high blood sugar is more than just feeling a tad tired after a long day. Here's why. When your blood sugar levels soar, your body struggles to effectively use glucose for energy. Think of it like a car running without proper fuel. The glucose remains in the bloodstream instead of powering your cells. Over time, this drains your energy, leaving you feeling constantly worn out. A study from the Translational Metabolic Syndrome Research, 2020, found that individuals with persistently high blood sugar reported significantly higher levels of fatigue. So, if you're always feeling exhausted without a clear reason, high blood sugar might be the unseen culprit. Always trust your body and consult a doctor if something feels off. Remember, catching these signs early can make all the difference. Next, number 4, slow healing. Slow healing of wounds is a concerning sign of high blood sugar. Wondering why? Elevated blood sugar levels can cause damage to blood vessels, restricting essential nutrients and oxygen from reaching the wound. A study in the Pharmaceuticals, 2020, found that high glucose levels impair the body's natural inflammation process, crucial for wound healing. Moreover, hyperglycemia can weaken the immune system. A 2021 article from the Frontiers in Public Health Journal highlighted that high sugar environments are favorable for bacterial growth, increasing infection risks. So, when you notice your cuts or sores taking longer to heal, it might be more than just age or a minor skin issue. Always consider checking your blood sugar levels. Your body's way of healing can reveal a lot about your overall health. Remember, staying informed is the first step to staying healthy. Next, number 5, persistent hunger. Persistent hunger, often termed polyphagia, is one of those sneaky signs of high blood sugar. But why? When your blood sugar is high, glucose isn't efficiently entering your cells. Think of it as knocking on a door, but no one's answering. Your cells need glucose for energy. Without it, they send out hunger signals, making you feel like you need to eat more. This cycle keeps repeating, causing constant hunger. A study from Diabetology, 2023, found that hyperglycemia disrupts the body's satiety mechanism. Imagine running a marathon and not getting the energy boost from your energy bar. Frustrating, right? That's what your cells are feeling. Always trust your body's signals, but if you're eating well and still feeling ravenous, it might be time to check your blood sugar levels. It's fascinating how the body communicates, isn't it? Next, number 6, tingling or numbness. Tingling or numbness, often described as a pins and needles sensation, is a common symptom of high blood sugar. But why does it happen? Elevated blood sugar levels can lead to damage in your nerves, a condition called diabetic neuropathy. Over time, excess sugar harms the walls of the tiny blood vessels, capillaries, that nourish your nerves, especially in the legs. This damage disrupts the normal function of the nerves, causing them to send signals when they shouldn't or to not send signals when they should. According to a study in the Current Diabetes Reports, 2019, about 50% of people with diabetes will develop neuropathy. When you feel that tingling, it's your body's way of sounding the alarm. Remember, if you experience such symptoms, it's essential to consult with a healthcare professional. Keeping an eye on your sugar levels and ensuring they remain balanced is key. Next, number 7, unexplained weight loss. Unexplained weight loss, despite a hearty appetite, can be a perplexing symptom of high blood sugar. Here's why. When your blood sugar levels soar, your body struggles to use glucose as its energy source. Instead, it turns to breaking down stored fats. This process produces a byproduct called ketones. While ketones can serve as an alternative fuel, they also get excreted in urine, taking calories with them and leading to weight loss. A 2019 study in the Medicina found that nearly 40% of individuals with elevated blood glucose experienced significant weight loss prior to a diabetes diagnosis. So, if you're shedding pounds without trying, it might be time for a chat with your doc. Remember, knowledge is the first step to health. Next, number 8, dry and itchy skin. Dry and itchy skin is often linked to high blood sugar, and here's why. Elevated glucose levels can cause dehydration by pulling fluids from your cells. When your skin loses moisture, it can become dry and irritable. Additionally, high sugar levels can affect blood flow, depriving the skin of essential nutrients. Over time, this can lead to dryness and itchiness. Research from the Clinical Diabetes, 2015 found that diabetes-related skin complications, including dryness, were prevalent in over 60% of study participants. Not hydrating enough can exacerbate this condition. Remember, your skin reflects your inner health. If you notice persistent dryness, it might be a sign to check your blood sugar. Always keep an eye out and listen to what your skin is trying to tell you. Next, number 9, dark skin patches. Dark skin patches, often seen around the neck or armpit, are known as acanthosis nigricans. This condition can be a telltale sign of high blood sugar levels. Here's why. Elevated glucose in the bloodstream can lead to insulin resistance. When your body cells become resistant to insulin, your pancreas compensates by producing even more insulin. Excess insulin in your blood can stimulate skin cells to reproduce at a faster rate, leading to thick, dark patches on the skin. It's like your skin is sounding an alarm that something's not right internally. In fact, a 2014 study from the Diabetology and Metabolic Syndrome found a significant association between acanthosis nigricans and type 2 diabetes. So, if you notice these patches, it's worth a chat with your doctor. Remember, our skin often reflects our internal health. Take it as a sign to listen and act. Next, number 10, bad breath. Have you ever wondered why bad breath could signal high blood sugar? It's all about the body's way of coping. When our blood sugar rises, our bodies struggle to use glucose for energy. Instead, it starts breaking down fats, producing chemicals called ketones. A particular type of ketone, acetone, is released in our breath, giving that distinct fruity or nail polish remover-like odor. This process is known as ketosis. Now, a study from the Journal of Clinical Endocrinology and Metabolism, 2018 found a direct correlation between the concentration of breath acetone and blood glucose levels. This means that if someone's breath smells unusually sweet, it might be more than just what they ate. It could be a sign of elevated blood sugar. So always listen to what your breath might be telling you. It could be crucial for your health. Next, number 11, stomach problems. High blood sugar can indeed mess with your stomach. Here's the scoop. Elevated glucose levels in the blood can lead to nerve damage called diabetic neuropathy. One type, called autonomic neuropathy, affects the nerves controlling the stomach muscles. When these nerves get damaged, your stomach doesn't empty as it should. This condition is known as gastroparesis. And guess what? Gastroparesis slows down or even stops food movement, causing nausea, vomiting, bloating, and heartburn. A study in Diabetes Therapy, 2018, found that nearly 50% of people with diabetes experience digestive problems due to high sugar levels. It's like your stomach's on a slow-motion replay. And folks, that's not just discomforting but can also affect blood sugar management. So, if your tummy's acting up, it's worth getting those sugar levels checked. If you or someone you know is experiencing these symptoms, it's important to consult a medical professional for proper diagnosis and treatment. Now that you're armed with this knowledge, will you recognize the signs? Remember, awareness is the first step to action. If you found this eye-opening, give us a thumbs up and share with loved ones. Let's fight high blood sugar together. Got a personal story or a question? Drop it in the comments below. And don't forget to subscribe for more life-saving insights. Until next time, stay vigilant and stay healthy.